Hi, Steve from Wandsworth Physiotherapy and Osteopathy. So next in my series of the most common running injuries is Achilles tendon pain. Now, it was previously termed Achilles tendonitis, however that's a little bit of an outdated term these days, and we tend to refer to it either as Achilles tendinopathy or Achilles tendinosis. And there's broadly two different types of Achilles tendinopathy that people suffer from. Now, people can suffer from what's termed a more acute reactive tendinopathy or a more chronic degenerative overloaded tendinopathy, and the two need slightly different management. So with the acute reactive tendinopathy, this typically comes on in people that have just started running and have done too much too soon, or people that have changed their running load over a shorter period of time, perhaps changing from 3 times a week to 6 times a week. And what people describe is feeling like a creakiness in their tendon, and when they get out of bed first thing in the morning it's quite stiff and sore, and they might be able to run through it, but it's quite sore while they're running, or it actually completely stops them from running because it's too sore. And on examination there's a swelling in the tendon sheath and it's quite tender to touch. Now this is an inflammatory problem, and it will respond really well to anti-inflammatories such as ibuprofen, for example, ice, and also a short period of complete rest from running and some strengthening exercises, and then that's usually enough over the course of a few weeks to get you back into running reasonably quickly. Now the next type of Achilles tendon problem is what we term a more chronic degenerative overloaded tendon. Now this typically happens in people that have been running for a long time, perhaps running 5Ks 5 times a week, or training for a marathon. There's more of a chronic overuse of the tendon and overload of the tendon. Now this typically presents as, again, being quite stiff and sore first thing in the morning. When you start running it feels stiff and sore but loosens up and you're able to train through it, and it then stiffens up and becomes sore again after training. And on examination what we tend to see is a little fusiform bump or thickening within the tendon. And what's happened is that the tendon microstructure and the collagen has failed to adapt to the loading over time, and a portion of that tendon can just start to become degenerative. Now people describe it feeling tight, and what they tend to do is try and stretch the tendon, but this isn't going to do anything. It's actually a tendon weakness, and what you need to do is strengthen the tendon with specific exercises that we can show you. And unfortunately it does take quite a while for the tendon to strengthen up and respond, and for your body to regrow that collagen within the tendon. And you can typically continue to run during this time, but you might need to reduce your training volume, usually around 40 to 50%. And another really effective treatment to have during that time whilst you're doing your strengthening exercises is a treatment called Shockwave, and there's information on our website about Shockwave and how that can help tendon problems. So there you go, we've got a reactive, acute tendon, and we've got a chronic degenerative tendon, and 2 different ways to manage it. I hope that helps.